My name is Rachel Gamber, and I'm going to share a few things with you about speech-language pathologists, are also known as SLPs, and also a few things about speech-language pathology assistants, or SLPAs. To begin, we will talk about SLPs. The roles of SLPs are to evaluate, diagnose, and treat patients with a speech or language disorder. Speech-language pathologists work alongside occupational therapists, physical therapists, and special education teachers. They also attend IEP meetings. IEP stands for Individualized Education Program. Speech-language pathologists go to IEP meetings to learn more about the student and the student's caseload. They also discuss how far the student has become in speech services. Speech-language pathologists also mentor speech-language pathology assistants. The speech-language pathology assistants go to the SLPs for important information and to also figure out what the caseload will be, as a speech-language pathology assistant cannot fulfill the duty to fill a caseload. Speech-language pathology assistants also cannot diagnose a patient. The scope of practice for a speech-language pathology assistant is to perform tasks provided, directed, and supervised by a speech-language pathologist who is ASHA certified. ASHA stands for American Speech-Language Hearing Association. Both the speech-language pathologist and speech-language pathology assistant have to be certified through ASHA before they can begin their duties. A few examples of where a speech-language pathologist and a speech-language pathology assistant can work are schools, nursing homes, and hospitals. In South Dakota, in order to become a speech-language pathology assistant, you must undergo 2 years of study at an institution for higher education and must become ASHA certified. Therefore, speech-language pathology assistants are educated in their practice, which helps them understand their duties. Speech-language pathology assistants are very valuable because they don't have the extra duties of a speech-language pathologist, so they can focus more on helping the patient. The speech-language pathology assistant assists the speech-language pathologist, not replace them. So since the speech-language pathology assistant is working under the supervision of the speech-language pathologist, they will always be knowledgeable and suitable for the position. By easing the workload of their supervising speech-language pathologists, speech-language pathology assistants help provide greater patient access to therapy services as they enable providers to take on more patients. Speech-language pathologists and speech-language pathology assistants are important in the therapy settings. Speech-language pathologists and speech-language pathology assistants are beneficial to many students in a school's setting. Thank you for your time.